Namaste and hello. Today, let us talk about the prognosis, that is the scope of treatment for Prurigo Nodularis using homeopathy. Well, Prurigo Nodularis is relatively very uncommon and rare disease of the skin, of course, and estimated 0.1% or even less world population seems to be suffering with this difficult skin disease. My name is Dr. Rajesh Shah. I am a director of Life Force, where we treat patients from across the world having all kind of chronic and recurring diseases, including a wide range of skin diseases. Prurigo Nodularis is a rare and ill understood disease about which our knowledge is limited in general because the exact etiology or the cause of this disease is not fully understood. It is definitely an immunologically mediated disease, but it also has certain genetic factors and parameters involved. This is a disease in which one presents with ulcerative lesions, some fleshy lesions on the skin, especially on the bony surfaces and the shins, but it can also affect hands, abdomen, sometimes face. And these lesions are often bleeding in nature, and they are extremely itchy. The itching in this disease could be really annoying to the patient, and it is very difficult to treat with even all kind of anti-itching conventional medicines. At Life Force, we have documented around 80 plus cases of Prurigo Nodularis from different parts of the world, and what we have observed is that using homeopathy, we can manage most of these cases reasonably well. I may not be sounding very positive because we cannot cure this disease. There is no treatment that is known today which can cure or eliminate this disease completely. The conventional medicine, they largely use various forms of immunosuppressive measures, and in our experience we have seen that by using corticosteroids or methotrexate or any other new generation immunosuppressants, Prurigo Nodularis might give initial relief, but eventually it doesn't yield, it doesn't get better with them. Homeopathy is definitely a strong option, and I would strongly recommend homeopathy in all the cases, and one should try out homeopathy without using strong medicines because homeopathy has shown efficacy in the cases of Prurigo Nodularis. At the same time, it is safe and it is free from adverse effects which otherwise one may get from the use of immunosuppressant medicines. Only if homeopathy doesn't work, then one should try for conventional medicine. Those patients who are already on conventional medicine for Prurigo Nodularis, and they should rather try homeopathy as well. And it will be little difficult to start homeopathy once you are already on immunosuppressant medicines, because the process of reducing the dose of the immunosuppressing medicine itself will take some time, and one has to be prepared for that. And there is no option because one may not be able to continue using immunosuppressive medicines for a very long time. The treatment duration for Prurigo Nodularis is usually long. Let me say it may take close to 1 year or much longer, depending on the extent of the problem and the previous treatments and the etiology of the causation. As I said, there are immunological factors. There are certain cytokines and interleukins which are elevated, and there are some nerve endings which get irritated or excited, which produces this intense itching. So this is a complex phenomenon, and I believe in the course of time we'll have even better treatment for this disease. I hope this video helps the general public, people suffering with Prurigo Nodularis, as well as the doctors of all kinds and the medical students. Thank you so much.